So clearly there is so much to discuss on the COVID front. You know, this morning we're going on the record with both the president of Newark University Hospital Dr. Shereef Elnahal and New York City Council Health Committee Chair Mark Levine, who is joining me here in studio. So good morning to both of you gentlemen. And I want to start right here on this topic of schools for a moment, right? Because we just saw some viewer comments already. And I want to read one right here from Rue. This one is very telling. She wrote, "I'm concerned they need to wear a mask, and I'm concerned they may not need to wear a mask. I am nervous regardless." So Dr. Elnahal, I want to begin with you here because parents are worried either way. So what do they do to keep themselves protected since those under the age of 12 cannot be vaccinated?
It's a good question, and appreciate the question from Rue as well. First of all, that is the most important point to make, the fact that children under age 12 simply cannot be vaccinated. And as we see the Delta variant now becoming the predominant version of the virus, and the fact that it's twice as transmissible as the virus that made us shut down society essentially about a year ago, worst surge we'd seen up to that point in any public health crisis, really concerns us. And so we are concerned about kids. We're seeing increased hospitalizations in kids across the country. And so that's where I think the CDC's guidance on masking in schools comes from.
So Councilman, what are the discussions then about mask wearing in schools or even remote learning versus in person again for the upcoming school year, right? There's a lot of talk about what is happening behind closed doors. What can you tell us?
Mask wearing is going to be required, I think, no matter what at this point because of the threat of Delta for students and staff as well. I think the question of in-person versus remote is still under discussion. Whether there will be only exemptions for people who have medical issues, students with medical issues, or whether it could be more broad, allowing parents to opt out at will. You don't want to undermine the need for every child to have a 5-day-a-week in-person opportunity. And so staffing and logistics become extremely challenging in the hybrid setting as we experienced last year.
So there is, it's not, the mayor is saying 100% certainty that there will be in-classroom learning. But if a parent says, I don't want to send my kid to school because I don't think that they're safe, what is the option for that parent?
The mayor has so far said they will not have an option to opt out. Clearly, for medical reasons, that needs to be available. But perhaps more broadly, this is a discussion that we need to have immediately, and we have to decide quickly. School starts in 6 weeks.
Exactly, and that's exactly the point, Dr. Elnahal. I want to bring you back into this conversation here because the CDC is now saying the Delta variant, there was a report that came out that said it's as contagious as chickenpox, right? More transmissible than a common cold, the flu, MERS, SARS, Ebola. So how, doctor, is the fight then changing against the virus?
It's making the fight a lot harder, and that's a very important point. Remember that if it's twice as good at spreading from person to person, that means the effect on a population can be a lot worse. You'll see more hospitalizations eventually, and then shortly after that, you see more deaths. And so that is why you saw this new masking guidance. The other piece of data that was concerning is that a vaccinated person can have as much virus in their nose, mouth, and other avenues of spreading it as somebody who's unvaccinated. That was something that the CDC discovered that led them to re-recommend masking indoors even for vaccinated people. Now, I do want to emphasize that it still prevents hospitalization and death to an extremely large degree. And so the recommendation is to get vaccinated. That is the only way for us to eventually move past this.
And that's where the conversation then of the vaccines and masks come in. So Dr. Elnahal, are you confident the vaccine, the current vaccine, will hold against the Delta variant and the other variants that are out there?
Every indication we have so far is that the vaccines are effective against the Delta variant in particular in preventing hospitalization, severe illness, and death. And that's the most important thing we are worried about. The potential to spread it from person to person is what the CDC is responding to. We don't have the final verdict on that yet, but it's looking concerning per the latest research I just mentioned.
Okay, so then that brings us to the conversation right here about mask wearing. And Councilman, you were on the morning show just about a week and a half ago talking about the idea of masks, right? And some people were saying, oh, we're not there yet. And here we are now talking about it. What's the likelihood that masks will be mandated if you go inside?
Well, Dan, we were there when we spoke a week and a half ago.
Yeah.
The facts have been on the table. It is risky now to have people indoors in places like supermarkets and movie theaters when there's no screening for vaccination or test status. The reality in a city where now we're over 1,100 cases a day on average is that in any crowded public setting, someone could be carrying the virus. And it's important that we protect everybody, kids who can't get vaccinated, people who are immunocompromised. And what's clear now is that even folks who have been vaccinated, as Dr. Elnahal said, are extremely well protected, but they may still pass the virus to others. So for all these reasons, we do need masking, and it's extremely frustrating that even with guidance from the CDC, New York City has not changed any of its rules or guidance since May, despite the new threat of Delta.
Okay, so a lot of people are talking about the masks, right? They're also talking about where we were a year ago in terms of lockdown. What are the discussions in the city council, with the mayor's office, about going back and shutting things down again? I don't want to say it because I don't want to put that idea out there, but are those discussions on the table?
Thankfully, with 4.5 million people vaccinated in New York City, we are not at risk of the kind of horrors that we experienced in the spring of 2020. And I don't think those kinds of shutdowns are on the table. However, the question of screening people for public venues like bars and nightclubs and movie theaters absolutely should be on the table. I think it needs to happen now to protect the public.
And Dr. Elnahal, what are your thoughts on that, right? Because you and I had this conversation once before about I wore a mask to protect other people from me, right? But if I'm vaccinated, I now have to wear, why do I still have to wear a mask? That's what people are asking, right? And what are your thoughts on that very issue?
Well, as I mentioned, the masks still are primarily for that reason, although it does give some degree of protection to yourself. But remember that the idea of vaccine verification, and I know it's a controversial topic, is such that you're, by definition, certain that you're around people who are vaccinated. And so in those scenarios, it would make sense to remove masks and be comfortable with it because you're ensuring that everybody around you is vaccinated.
And doctor, what are your thoughts then on hospital workers? I know you guys have to get vaccinated within the hospital setting, but just wearing a mask in general indoors.
I think it's the right thing to do now. I think the CDC is responding to the latest information. I know it's humbling. I know it's not good news. And I know that people are tired of wearing masks, but this is about health and safety first and foremost. And we have to take those recommendations very seriously as we prioritize our own health and the health of our loved ones.
Yeah, and this is an ongoing conversation, rapidly changing. City Councilman Mark Levine, Dr. Shereef Elnahal, thank you both for being on the record this morning on this very important topic.
Thank you, Dan.